Hello and welcome to the CSR Journal. Today, we have a special guest with us, a noted pulmonologist from Bardhaman, West Bengal, Dr. Anirban Biswas. Hello and welcome to the CSR Journal.
Thank you.
So, as we all know that World No Tobacco Day is celebrated every year on the 31st of May. Why is this day observed? The purpose is to spread awareness about the ill effects of tobacco, the diseases it causes, and even the deaths caused by tobacco across the world. So, we are here to talk to the doctor.
There are multiple ill effects over human body. One is most important is the respiratory tract, where the patients, the persons who are smoking, they are having varieties of respiratory problem, particularly COPD, obstructive lung disease. They are suffering from shortness of breath, and that is progressive, and ultimately that disease make them incapable to do anything, and the later phase of life of these patients are very miserable. Second is tobacco is also responsible for a substantial number of cancers of lung, particularly of lung. Third is not only of lung, but this tobacco also causes smoking and other tobaccos, chewing tobaccos, they cause cancer with the mouth, gastrointestinal tract, our urinary tract in the vesicles, and in also in the kidney. Apart from the lung and this cancerous diseases, tobacco also has got some significant bad effect over our heart. It may cause or it enhances the possibility of heart attack, cerebral stroke, and gangrene of limbs. That is called Burgess disease. Actually, tobacco or in the form of smoking or chewing tobacco, the nicotine that enhances the atherosclerosis of our vascular system. That means our vessels that helps us to flow blood in different parts of the body, they are getting blocked. So in that case, if it is in heart, there is chance of heart attack. In brain, there is chance of stroke. In limbs, there is also chance of Burgess gangrene. And another important point is that that part is neglected. I think this tobacco, the bad effect in women, particularly those who are carrying babies. The women who are carrying babies, the tobacco that cause intrauterine growth retardation. That means the child that are born up, the babies that are born, they are below their normal weight. They suffer a lot of diseases. These babies, particularly some congenital anomalies like that cleft lip, cleft palate. This child may have some neurological problem. That means there might be possibility of sudden abortion of the baby. After delivery of baby, they may feel they may have the experience of severe bleeding. So tobacco smoking in pregnancy period, particularly for that woman, this not only they are causing harm to their body, but also the babies they are carrying.
So, as talking about passive smoking, sir, you were just mentioning that how harmful. So, if one person in the family is smoker, and maybe the father, maybe the mother, so how does it affect the other people present inside the same room?
Almost to the same extent. The person who is actively smoking, and his near ones, who are those who are present in the same room, they are almost having the same smoke, and they're having the same risk. Particularly, you have seen in the children. For example, father is smoking inside the room, children are playing or they're studying, the smoke they are also inhaling, and from the very beginning of their early life, they are having different types of respiratory problem, particularly shortness of breath, a sort of asthma, and other older people, those who are patient in nearby, those who are already suffering, suppose they are suffering from diabetes mellitus, they are taking some antihypertensive drugs. That means they are suffering from blood pressure, or some heart disease. They are taking some medicines, and at the same time, they become the victim of this passive smoking. Their chance of further is that I have told earlier, that smoking, that stroke, heart attack, that increases.
Sir, we have often observed that a person who is quitting smoking, they face some kind of physical problems as well as mental problems? What are the problems faced by smokers who, after quitting?
The problem that often they face that they are having some digestive problems. They are not having their bowel movement properly. They are feeling some irritation. Often they are impulsive in their behavior. Many of them are having problem like sleeping disorders. But I am telling you, these disorders, these problems, they are for short time. If that person mentally prepared to quit the smoking, and with some few medicines that the doctor can prescribe, this take this one or this one, this will suffice for to him to relieve this quitting.
Absolutely, sir. I would request you to kindly share a message for our viewers on No Tobacco Day.
To all my viewers, please leave tobacco, not only in the form of smoking, also in the chewable, that is called in our country, that is called koini. Because these are disasters. This will put you in serious health trouble. Not only health trouble, in future this will put you in some financial trouble also, and you have got some of your family that you are supposed to look after. So we can do anything, not only your health but also your family members also suffer. So please quit tobacco.